We are first starting with the skin and hair analysis. Very happy to see all old faces over here. The growth phase of the hair and any abnormalities of the hair. But basically, this is going to be another technician job. Actually, not our job. A good technician can do it, because as a clinician, we will be able to tell whether the patient is suffering from cirrhosis, whether the patient is suffering from any seborrheic dermatitis, what is the type of hair fall, whether it is hormonal, whether it is hereditary, whether it is nutritional. But few patients who are overactive, over smart, patient who all go on for a computer, who have a computer, they search for all these things and they come and talk to us in a nonsense way. For those type of patients whom we are not able to convince, whom we are not able to tell a diagnosis, if you tell a diagnosis, they are not able to digest it. For those patients, we can very well use this skin and hair analysis system. A simple system, everything is loaded there. It has a dermoscope. Just use the dermoscope on the hair or on the skin. We get a beautiful chart describing about the skin and hair. So just we are going to start the procedure. So this is the chart. This will be something like the result, like the sebum content of the skin. Sebum content, this is a dermoscope. You just keep it on the skin. Everything comes out like a picture. These are all few captured images. Few captured images from here. But as such, as I told you, everything is to convince patients only. Our diagnosis will be exactly correct. We are going to start the case on vitiligo now. I am going to demonstrate 5 surgeries for vitiligo: punch grafting, skin grafting, tattooing, 5FU and targeted phototherapy. First, to start with, punch grafting can be done on all areas. Can be done on all areas. That includes mobile areas, immobile areas, all sensitive areas. You can do on palms and sole, you can do on genitals, you can do everywhere. The only one thing, we should see that we don't allow a window effect. Otherwise, we start from the border of the recipient patch. Donor to recipient, you can give a gap of 0.5 mm in the punch, or you need not even give a gap. So that is not going to make any difference. Earlier we used to say we give a gap of 0.5 mm for skin to mucosa or skin to skin. But as such, we don't need it now, because you cut a large chunk of the recipient site, you are going to remove the vitiliginous area. Even a mere trauma is going to produce a pigmentation, otherwise a post-inflammatory repigmentation. If I am exactly correct, you don't do a graft, you just use a needle, you do a multiple punctures on the recipient site, it's going to repigment. It's otherwise inhibition of the melanocyte Calon factor.